All right. Well, I hope everyone can see the screen and you're all settled. So welcome back to the Rocky Mountain REACH program, where our goal is to accelerate medical innovation in our region. And I'm Sarah Trulio, and then my colleague, Carl Unterschutz, the program director for Accelerate Montana Rural Innovation Initiative, will be on hand to answer any technical questions about the program or the application process. So we're going to dive right in. Last week, we discussed how to determine the specific healthcare problem or unmet need that your innovation addresses. And we also asked you to define the technology you've developed or are in the process of developing. And maybe help us understand its features, functionalities, and intended applications. And then this week, we are in workshop number 2, and we're going to discuss market validation, or what I like to call market opportunity. So understanding the market is crucial for the success of any technology or solution. And market validation really serves as your compass that's going to guide you through product development and navigate towards commercial viability and social impact. And this section serves as a primer on the significance of market validation, and it outlines the key elements involved in the process. And so diagnostic tools, medical devices, or therapeutic solutions are designed to address specific healthcare or medical challenges and improve patient outcomes. However, the existence of this breakthrough does not guarantee that it'll be adopted or success in the healthcare ecosystem. So without a deep understanding of the market dynamics, you risk investing time and resources into solutions that may not meet the needs of patients and healthcare providers or stakeholders. So according to the Harvard Business Review, over 90% of startups fail because they are creating products and services that no one wants and needs. So market validation provides insights in the demand for the technology, the competitive landscape that you're going to see, so who your competitors are, and then the pathways to market adoption. And by conducting a market analysis, you can identify opportunities, anticipate challenges, and then tailor your solutions to address the unmet needs effectively. And market validation essentially minimizes the risks associated with product development and increases the likelihood of achieving commercial success and social impact, which is why we were all gathered together. So by focusing on these elements, target customers, market size, competition, and your value proposition, we will gain insights that can inform product development, your go-to market strategy, and ultimately the success of your innovations. And identifying your target customers is essential for tailoring the technology to meet their specific needs and preferences. And depending on the nature of your innovation, customers may include healthcare providers, patients, caregivers, payers, such as insurance companies or government agencies, or a combination of all of these stakeholders. So you're going to need to delve into some demographics, some behaviors, and some pain points of your target customers to really develop solutions that resonate with them. And so, how do you find your customers? And who are they? And what do they need? And do you offer a product that fits this need? And finding your target market involves a combination of market research, stakeholder analysis, and some strategic planning on your part as well. And here's a process for successful customer discovery and customer development. And those of you that have participated in the I-Core program previously may be familiar with the customer discovery or customer development process. And so first you want to create a list of potential customers or markets who can use your solution. And then you want to conduct some market research. So you gather some data on the healthcare landscape that's relevant to your innovation. And this could include disease prevalence, patient demographics, healthcare infrastructure, maybe the regulatory environment, and what the competitive landscape looks like as well. And I'll provide you with some resources at the end that can assist you with your research efforts as well. And so the next step would be to segment your market. So you want to divide a broader healthcare market into segments based on relevant criteria such as demographics or geography, maybe special healthcare needs, as well as behavior. And here's an example. So some segments could include specific patient populations, which are very important to know about, healthcare providers, or healthcare settings. So things like hospitals, clinics, home care, etc. And then make sure that you really understand their needs, right? So identify and understand the perspectives of key stakeholders. So who will interact with or influence the adoption of your innovation? And I'm going to ask you a little bit later about this too. And this could include healthcare providers, patients, caregivers, payers, again, insurance companies or government agencies, the regulatory bodies, and then any industry partners as well. And finally, you want to evaluate your market attractiveness. So assess each market segment based on factors such as size, growth potential, competition, again, regulatory requirements, those are very important. What the reimbursement landscape looks like from insurance companies and other payers, and then the fit with your innovation's capability and your value proposition, which is also very important. And by following these steps, you can identify and target the market segments that are most likely to benefit from your innovation, and ultimately increasing its chances of success and impact in the healthcare ecosystem. And so if you have teenagers or you have ever taught a class before, these expressions are probably very familiar to you. But your customers feel the same way. So customers don't care about your technology. They are trying to solve a problem. And customer discovery is about identifying that problem and exploring how you or your potential innovation can solve it. So here are some questions that may be helpful to you to narrow down your target customers or your target market. So you want to know who are you intending to help? Who benefits the most from your innovation or your solution? And then what is this person trying to accomplish? Are they satisfied with the current solutions that they're using? Would they like something better? What problems do they face accomplishing these tasks? So what motivates their decisions to utilize their current solution? And then how is this problem being addressed? So what are your competitors doing or understanding the current standard of care? And what benefit or value can you deliver? What is your value proposition, and why would they choose your solution or innovation over what's already on the market? And here's an example of the customer development process of defining a target market using the example of a diabetic diagnostic device. And so using the market segments of geography, patient population, healthcare setting, and then other relevant criteria. So the target geography is urban and rural areas within the United States where access to specialized care services might be limited, particularly in underserved communities. And the primary patient population consists of individuals diagnosed with diabetes, particularly those that are at risk of developing diabetic retinopathy. And this includes both type 1 and type 2 diabetes patients across different age groups. And the healthcare setting would be where diabetic patients receive their routine care, so including primary care clinics, community health centers, diabetes clinics, or telemedicine platforms, which are becoming more and more popular. And then the other relevant criteria is the disease severity, access to care, and then economic status. And so why do we do customer discovery? Well, because it stops us from building things that no one wants or needs. It also helps us, stops us from building things that are no longer relevant in the market. And it does help us deliver our solution to those that need them the most and get our solutions to the market quicker. And understanding the market size is essential for assessing the potential demand for the solution. So within a specific geographic region or demographic segment, could be age, could be, how much money they make, it could be their level of education, you'll have to assess that, and the revenue opportunity for the technology. It involves quantitative analysis of data, so healthcare spending trends, and then the regulatory frameworks to estimate the addressable market. And then by quantifying the market size, you can gauge the revenue potential and then if there's any scalability. So market opportunity analysis. So when you're conducting your market research, you are trying to learn how big your market is, right? How big of a piece of the pie can you possibly get? So here are some things to think about. You want to identify the customer and the market need. Is it a shark bite issue or is it a mosquito bite issue, right? Or is it a nice to have versus a need to have? And then how many people out there have this problem that you have this solution for? And then where are they located? Are they located in the same central area or are they on opposite sides of the United States? So who are the competitors that are also trying to solve this problem? It's important to know that. And then how can you scale this solution to address more unmet needs? And here's just a quick example of market potential. So you start out with your total available market or your TAM, which is your total revenue opportunity, right, for your innovation. And you want to find out things like how many people want or need this solution, how large of a market is there if they all bought your solution, and then who are the competitors that are also doing the same thing. And then you want to move on to the served available market or the SAM, which is your potential sales value of the specified market segment. And it's really about, finding out about how many people can use your solution and how many people have the money to pay for it. So if you have a great solution to something that is a huge problem, but you're in order to make it and produce it and sell it, and you're charging way over what people can afford, probably your market isn't going to be as big as you thought it was, right? And then finally, you want to narrow it down to your target market, or your TM, which is the market size that you can realistically serve. So, if 10 million people have the issue that you're trying to provide an innovation or solution for, likely because of regulatory framework and funding, and other things, you probably are not going to be able to serve that market realistically, right? So you want to kind of narrow it down and figure out who you're going to sell to, and then how large is that market if they all bought your product. So your circle is going to get smaller and smaller and smaller as you refine and iterate your market to ensure that you're serving the people with the actual need for your solution. And I'm not going to get too in the weeds with this because of time, and nobody likes doing math all the time, probably. So, but the next two slides will show some examples of some formulas on how to calculate your TAM, SAM, and TM based on your market research that you do. And so for this example, we're going to use the salmonella vaccine. And these are fictitious numbers just for this example. But here's the calculation. So to figure out your TAM, the formula would be rural population times incident rate times average spending per capita to address this problem. So the TAM would be 10 million times 5%, which is your incident rate, times $5, which is your capita to address this problem, the spending capita, which equals 2.5 million. So your SAM depends on the distribution reach, the production capacity, and the marketing efforts. So let's assume that you can initially target 40% of what you think is your total addressable market. So the formulation is 40% times 2.5 million equals 1 million. And then to further refine your market for initial penetration, you might prioritize regions with the highest incident of salmonella infections and establish partnerships with local healthcare providers and agricultural organizations so that you can learn more about the demographics. And here's another example using a software tool to assess outpatient stroke and aphasia rehabilitation. So the TAM formula would be rural population times prevalence of stroke times prevalence of aphasia times average spending per capita to address this problem, which 500,000 was the rural population that is affected in your region by this, times 2%, which is the prevalence of stroke, times 70%, which is the prevalence of aphasia, times $50, which comes out to be about 350,000. So your SAM, again, it depends on your company's distribution rate or distribution reach, production capacity, and marketing efforts. So let's assume you can initially target 30% of the TAM. So the formula would be 30% times 350,000 equals 105,000. In your target market, you may prioritize regions with higher concentration of stroke and aphasia patients, such as areas with aging populations or limited access to specialized healthcare services. And so I think you're all familiar with scientific ecosystems, but each industry also has its own ecosystem. And an industry ecosystem is a community interacting as a system through the flow of materials, money, information, and the flow involves decision-making and creates value. And so customers are not the only people that are in your ecosystem. And it's important to understand your industry ecosystem and how to navigate through it. So here's an example of a medical ecosystem map and some important questions to address when you're considering who's in your ecosystem, right? So you want to know who your stakeholders are. How do they interact? Where is my customer on this map? Where does my solution interact? And what changes if my solution is adopted by my stakeholders and my customers? And what am I missing? This is really important. So are there any blind spots, opportunities, or threats that I am not seeing? And so most of you, I think, are going to be patient-centric, which is why the patient is in the middle of the ecosystem map. And the decisions are going to revolve around a patient's needs and care. But remember that these decisions are not always made by or paid for by a patient. And so here are some examples of stakeholder roles. And what roles does everyone play in the ecosystem? So an end user is the person who uses the product or the service. The buyer is the decision maker, the person with the authority to decide which solution gets adopted. And these people are very important to know. The payer is the person who has the budget for the solution, but is not always the patient. The influencer is the person who weighs in on the selection, adoption, or the purchase. And then the recommender is the person with tasked with making the solution recommendations. And then finally, the saboteur. And this is the person who loses out if a new solution is adopted. And so using the center image and putting things in chat, can anyone tell me who an end user is on this map and who might be an influencer and who might be a saboteur? So if you look at it, the center section is the patient and the citizens. So think about, are they your end user? Or are health and social care companies or other private industries? And then who might be an influencer that would help get your technology adopted? Is it universities and labs, local authorities, governments, associations, providers, professionals? And then who is a saboteur? So someone that does not want you to be successful with getting your innovation to market. Investors, insurers, other companies, competitors. So something to think about. And here's some simple questions to ask to find out who's in your ecosystem. So who is going to be using your product or service? Who influences its use? And who pays for the product or the service? And how is your product going to get to your end user? And how will your product get to your customers? And then who regulates what you do? Who influences what's heard or known about your product or service? Who are your competitors? And where do I find funding for my product or service? And then who will care if someone else uses my product or service? And so we're going to talk about competition now. So assessing the competitive landscape helps you understand the strengths and the weaknesses of existing solutions in the market. And by analyzing competitors' products, pricing strategies, distribution channels, and market positioning, you can identify opportunities for yourself. And this also enables you to anticipate any potential barriers to entry into the market and devise strategies to overcome them. And here's an example of competitors that a small rural biomedical company producing a diagnostic device for respiratory monitoring might encounter, potentially large biomedical corporations, specialized medical device companies, startups and innovators, academic and research institutions such as yourselves, global health organizations, and NGOs. And here's an additional example using a software-based cough therapy solution. And their competitors might include digital health platforms, telemedicine providers, healthcare software startups, academic and research institutions, and then mobile health apps. And so a good way to differentiate yourself from the competition is to have a strong value proposition. And a value proposition articulates the unique benefits and advantages compared to your existing alternatives. It captures the reasons why customers should choose your solution over others in the market. And a compelling value proposition addresses key customer needs, delivers tangible outcomes such as improved clinical outcomes or cost savings, and it differentiates you from your competitors. So crafting a compelling value proposition requires a deep understanding of customer insights, market dynamics, and unique features of the innovation. And your journey should always start with your customer and align with knowing how you address a significant pain point that they are experiencing. So really, how are you adding value to their lives? And what need are you satisfying for them? And a value proposition needs to relate to the identified strengths and weaknesses of your competitors and why customers would choose this product. So really make sure that you stand out from what your competitors are doing. And so for this example, we're using the portable lung airway clearance device. And this is what a value proposition for this device could look like. This device is compact, lightweight, designed to seamlessly integrate into daily life, whether at home or on the go. Users experience targeted and efficient airway clearance, promoting better lung function and improved respiratory health. The design ensures ease of use and comfort, empowering individuals to take control of their respiratory wellness with confidence. All right, now we're going to talk about some barriers to entry. So living in rural areas has many benefits, but innovating in rural areas can cause several barriers to entry. And some of those include limited access to a skilled workforce, infrastructure challenges, funding constraints, regulatory compliance, market fragmentation, supply chain disruptions, which we saw a lot of during the pandemic, limited access to healthcare facilities, technology adoption, healthcare disparities, and then competition from established players already in the market. Addressing those barriers requires really innovative strategies, partnerships with local stakeholders, and tailored approaches to meet unique needs and challenges of the rural communities that we live and work in. And so here are some innovative examples of how you can turn barriers into opportunities by investing in local talent, leveraging technology, diversify your funding sources, streamlining any regulatory compliance, tailoring products to local needs. We talked about really refining your target market, making sure that you're offering something in your region, right? Optimizing supply chain management. Don't just rely on one resource for that. And then forging strategic partnerships, really focusing on affordability and accessibility, and then investing in education and awareness so people are aware of your innovation and differentiating through innovation. And as I promised, here are a good list of resources that may help you with your market research and putting together your analytics and figuring out your target market. So libraries are a great place to get information that you need from. There's reference and research librarians that have access to databases, journals, and often libraries provide a one search service. So should be, mostly free information for you. Local economic development councils also have access to databases such as MZ and ESRI, which are layered GIS mapping that can give you demographic information. The U.S. Department of Census and other government databases can give you really intense and useful information by geographic locations. And your city, county, and health department often keep really good records and have funded studies that could revolve around your innovation to get information from, demographic information or health crisis information, industry reports and industry associations, academic research at the University of Montana. We have the Bureau of Business and Economic Research. They have databases and reports and statistics for the state of Montana. Likely your state has something very similar through one of your land grant or flagship universities. And then scientific publications. I'm sure you all receive a ton of these. But really, combing through relevant materials can help with your application. And then regulatory agencies, FDA, USDA, AMA, often have free resources and reports that you can access. Healthcare providers are also great resources. And then key opinion leaders. This is really important, especially on the local level. So think about people in your communities like hospital directors, advisory boards, tribal councils, chief medical officers, nurses, even the mayor, chief of police, fire chief, EMS, etc., have valuable information that they can relay to you. Patient advocacy groups and patient surveys, and then competitors' KPIs, so key performance indicators, and any pilot studies can also help you put together tons of research that can help your application. All right, well, we are at the end of my presentation, so I'm gonna end the slideshow here, and if anyone has questions or needs clarification on anything, now is the time to ask.
Thank you, Sarah. Just like last time, if you want to use the hand raise function or put your questions in the Q&A or in the chat, however you prefer to ask them. I really appreciated your last slide with all the different resources, and one other that I've been brought to my attention is different resource libraries, like within business schools can be a great resource. And this is also a good opportunity, an area where you could bring in, everyone here is affiliated with a university, so bring in, business students. A lot of what business students have to do is doing market sizing for different projects. So I know, Sarah, can you speak to that piece a little bit more and partnering with business schools just in general?
Yeah, absolutely. I think, anytime that you have a research project or you can offer some kind of benefit or experiential learning opportunity to a student that they wouldn't normally have access to, I think that you're doing a great thing and making an impact for them. It's pretty easy to connect with the advisors at the business schools. Also, the economic department. This is what they do all day long is, compiling data and, data research and statistics and things like that. And they often have students and clinics that are looking for projects. So I would definitely reach out to those departments if you need an introduction to University of Montana departments. Please reach out to me. Happy to help with that. And oftentimes students will get involved in regional projects as well. So don't discount if you're not able to find the right person at your university. We can try and find somebody that might help you as well. We are going into summer session, so students might have more time and flexibility to work on something. Also, if you have a little bit of funding in your department, offering internships is a great, where it's very specified. It's a project support intern where they are just working on this for you, and it's a specified time and project so that they're only working maybe 50 hours or something on this for you. So it's very economical. Carl, do you have anything to add to that?
No, I think you covered that really well.
Okay.
Kind of curious to hear folks' questions. I just say that customer discovery, I think, is one of the most challenging things to do for entrepreneurs because it isn't comfortable often to go talk to people outside the lab or out, those folks you're going to go sell to potentially in the future. But those are exactly the people you need to start to get close to understand what it is they're challenged with.
Yeah, agreed.
Looks like we do have a couple questions. Tao, I will call on you first.
Yeah, thank you. Thank you for the great information. I learned a lot. My question is that, I'm an engineering professor, so some of the data, like market size, how many customers could benefit from this, etc., where could we find those information?
Yeah, remind me again what your technology is, just
To clear lung airways.
okay, to clear lung airways. So I think I would go back to the resource list that I provided. And so, are there any patient advocacy groups or are there any associations that are involved with that aspect of healthcare that could provide you with some information, right?
Okay.
So how many people do you think in the United States suffer from the affliction that your technology could potentially solve for them, right? Is what you're trying to.
Yeah. So I guess I don't have to constrain to the Rocky Mountain area, right? It should be pretty broad to the nationwide, even worldwide. That's why I want to make it clear. Should I just focus on this region or talk about the population, even worldwide or
Yeah,
nationwide?
so I think that would be better addressed by somebody on the REACH team as far as what they're looking for in the application. I think we talked about that last week, that it's okay to use a larger target, but then you sort of want to refine that down to what is the impact that you can make not only in your region, but in the whole of US, right? So
Okay.
start smaller and then kind of,
Yeah.
Yeah,
Okay.
I think that's a great answer. Thanks, Sarah.
Okay. Thank you.
Yeah.
Yeah, and just to follow up on that a little bit with all this great information Sarah and Carl have put together, the application will ask, I think it's 500 word limit, what's the market opportunity? You may actually be using this funding to further delve into that and further refine that. Like that can be a milestone in your project plan. What we're generally going to be asking is, yeah, like what Sarah just said, is like this bigger need, big question, that there is a need out there that you've identified.
Thanks, Caroline. Looks like Cindy has a question. Go on ahead, Cindy.
Thanks, Caroline. That kind of helped answer my question a little bit. I was trying to marry some of the information in this workshop and think about how it applied to the, you know, the application, and looking at that question about the market. You know, are you hoping to see TAM and SAM, and, you know, is that sort of what you're looking for under that question? I guess it's written in a way that's a bit more general, and so that's got me thinking about that.
Yeah, I mean, I think Sarah's part of what Sarah's role is, and our role is to give you this additional tools and information. But for the application itself, like, again, we understand these are early stage technologies, and that your application, like, that's, you know, you've all recognized that there's a gap, and so that can be articulated. And so again, it may be that part of one of your milestones is like having a TA like help you, or RA like help you suss out some of this market research, like partnering with a consultant. That's completely plausible. I think we just want you to think in terms of your planning backwards from your end goal, and to reach that end goal, what would be most helpful for you at this stage.
Yeah, very good. Thank you.
Yeah, it's really in the beginning, you're kind of your best guess, right? It like this is your hypothesis that you're trying to test. And so, you know, your best guess is that, you know, X, Y, and Z are going to want to utilize this technology, right? And then kind of finding that subset of like, okay, well, there's based on this research, there's 100,000 people in my region that potentially could benefit from this solution. So I hope that helps.
Yeah, and when you know, if you are awarded, like, you'll have access to us as individuals and as an organization to help you kind of figure out, like Tal said, like maybe where to start, more specifically and regionally. Like, we'll help you do that, specifically identify those resources as well. But a great place to start is this more general areas that Sarah's pointed to.
I might throw in there, as I think others on the call have done this too, to see what you all think. As a reviewer, not necessarily of this application, but of entrepreneurial applications into competitions and so forth. One of the things that I've heard lots of reviewers say, and I've experienced myself, is you kind of want to quickly see the funnel. So if you can say, the market is, you know, back the napkin about this big. There are 100,000 respiratory clearing devices sold every year, or whatever the number might be. And then they cost roughly this much. This is roughly how they go into the marketplace. And we're solving this problem right here. We're reducing the cost in half, and we're expanding the market by double. Now I'm being sort of perfect scenario there maybe, but that's the idea. Start with a big funnel, sort of say, back of the napkin, we've got some big numbers here. Here's where we're going, and this is how we solve a real problem. And the details often can come from when, if you do some of that market discovery, or you do a little bit of that customer discovery to understand the language that people are saying they're frustrated or challenged with, that's where that difference can happen. So if you say, oh, put that down at the bottom of the funnel saying, here's where the bottleneck is, and we're solving that bottleneck. I didn't articulate that very well, but that's the piece where the numbers are important, but then get to the place where this is where we really fit into it. So Tao, for you, maybe, I mean, I don't know, I'm just going to think off the top of my head here, but if you could go to market in a couple different ways. I'm not sure how these devices are sold, but they're probably sold through distributors. And so if you could find distributors that are saying, that might tell you, hey, yeah, the thing we have now works just fine. No one's really complaining about it. That's hard to get over. But if you can find that customer to say, wow, yeah, the things we're selling today aren't working very well. We have EMTs or nurses or home care folks that are saying this stuff is causing me a lot of frustration because I can't get it to work right. And then that goes into where your customer base, where your target might be, the solution is.
Yeah, great, thanks. Yeah.
Yeah, and I think just to add that, sometimes you're going to start off thinking, okay, these are my customers. I know these are the people that want it. But then by the time you get done with your customer discovery, you've realized that there are several other market segments that actually need it or can be applied to, and your original customers are not necessarily the ones that will benefit the most from it. So it gives you other opportunities as well.
There's a great example. I'll try to make it very quick where when you're asking questions in customer discovery, if you were to go to talk with somebody as a researcher and you ask them, you're doing something on diet, for example, and you ask somebody, do you think you have a good diet? And they're going to respond often, yeah, my diet's good. I take care of myself and I eat well. Alternatively, if you ask them, hey, I'm doing some research on sort of what people are eating and just kind of get a sense of what your day's like. Can you tell me when you go through your day, what do you eat? Let's start with the day. Like, you get up in the morning, what do you eat? And you're like, well, pretty busy. I grab a cup of coffee, and then, maybe by 10 o'clock, I got a second cup of coffee. And if I'm not too busy, I get a Danish. And they say, okay, well, tell me about lunch. Do you get lunch? Like, well, yeah, sometimes we get pizza because we're working in the office, we're doing stuff. And then you go, okay, what do you about dinner? Like, well, dinner, I usually have like a big dinner. I have pasta or something, and then we go out with friends and then have a couple drinks. So now you've got exactly what they do, right? You understand the difference between, I think I have a good diet versus exactly what I'm doing. And then you might say, well, when you're going through your day, what are those things you run into? What are the challenges you have when you are choosing what to eat? And people might say, well, in the morning, I wish I just had more time to choose what to eat. So you understand then that's the hurdle for somebody who does want a good diet, say they do have a good diet, but they're just drinking coffee for breakfast. Now, I'm not making assessments around that's a good diet or not, but that's an example of the difference between someone's self-interpretation and what they're actually doing. And the other pitfall is if you go to tell somebody, hey, I've got this great idea, this new device is going to clear airways super well, it beats everybody's other airway devices. What do you think? They're going to say, wow, it sounds great. It's awesome. But if you tell them, hey, when you use an airway device, tell me what the challenges you run into, or tell me how you go about operating it. How long does it take you to set it up? And if you can't even watch them do it, right? So that's the difference. Let's get into exactly what they're doing. And you all are innovators and researchers, so I'm sure you do that every day.
Thanks, Carl. Yeah, and I'll just say, like thinking about the goals of the REACH program in general, a lot of, I think, what the intent of some of the application questions are is to help us look at your projects and say, oh, they have thought this through to commercialization. Like maybe we don't know exactly how, but that's sort of the direction that this project is going in, as opposed to just continuing to research a solution without having thought of the market. And so again, going back to the specific application questions, you might not have done some of this very specific market research, but at least you've given it some initial thought of, this is what my potential market could be, and I might take a little bit of REACH funding and apply it to, like Caroline said, hiring an RA to dive into that a little bit more, but just so that we can see that there's, or not me specifically, but that thought process has been included in crafting your project as a whole. Great. Any other questions or thoughts from anyone? All right, well, given that I don't see any, I'll just remind you all again that we do have office hours coming up this Thursday and Friday at noon. And I will send out the recording of this webinar and the slides. And then, one of the other sort of goals of the REACH program is to help prepare some of these projects for follow-on funding through SBIR, STTR, and I actually attended a workshop similar to this a couple weeks ago that was hosted by the Montana Innovation Partnership out of Bozeman and the New Mexico FAST program that was more specific to SBIR and STTR, but it did talk a little bit more about some methods for identifying the TAM and the SAM and the SOM that Sarah talked about. So I will see if I have the recording to that. And if I do, then I will include that when I send out the recording for this as well. And again, that's targeted a little bit more towards some different funding mechanisms, but could still be useful in thinking about the market potential of your project. So if there aren't any other questions, I will sign off and thank you all again for your time, and we will see you next week.
Thanks, everyone.
Bye.